Welcome Dr.
It's a big company.
who is here to talk
In the
to us
news every
today about a
Good and bad.
project that some of you who are previous Madison Trust participants may have seen in the past. But with that, I don't want to steal his thunder. Dr. Holland, feel free to begin.
Fantastic. Thank you, John, and thank you for having me this morning. My name is Keith Holland. I'm the Associate Vice Provost for Research and Innovation here at JMU, and I've been a part of this project for several years, about 4 years now. And I'm excited to talk to you today about the Chronic Cough Suppression Project, which showcases the translation of JMU research into application with medical well-being impacts. And to begin, I want to invite you to entertain a brief fictional story about Nancy. Nancy is a 36-year-old wife, mother, and a middle school teacher. In the fall of 2018, Nancy awoke with a cough and a stuffy nose. Not a big deal, just a common cold. And of course, she was right. Over the next couple of days, she got a sore throat and all of the symptoms of a common respiratory virus developed. But within a week, most of the symptoms had subsided and she was feeling much better. But the cough lingered. In about 4 weeks, Nancy was becoming frustrated with this lingering dry cough. Some nights she would lose sleep and wake exhausted. The episodes seemed to come on at the worst times, when she was helping students or when she was in an important faculty meeting. This would often cause disruption and embarrassment. With the cough persisting for over 6 weeks, Nancy sought medical advice. She was becoming worried. What if this is something more than just a cough? Following months of medical evaluations, tests and examinations, and worrying over the potential results, thankfully, the results ruled out any serious conditions. But with all medical causes ruled out, Nancy was diagnosed with what is known as a chronic cough, with no underlying cause, and she was directed to manage those symptoms as necessary by using cough suppressants and lozenges. Nasal surgery was suggested as one potential but not guaranteed way to alleviate her symptoms. And although the cough never completely subsided, the episodes were less frequent during the summer months. But the next fall, they started to resume again at the most inconvenient times and often associated with stressful situations. Nancy disliked taking cough medicines because they made her feel groggy and disoriented. Chewing gum and lozenges would help manage the symptoms and occurrences sometimes, but would not completely prevent them. These nagging symptoms persisted in waves for several years without specific triggers being identified. Was it allergies? Was it the weather? Stress? A combination of these things? And of course, as you can imagine, during the pandemic, this caused a lot of stress and concern. Am I more susceptible? Will others think that I have this virus? What happens if I cough during a meeting? And probably many of you in the room right now are conscious of am I going to cough? And what's that going to mean? Nancy's story may seem familiar to many of you in the room. It's not an uncommon scenario. Clinical studies estimate that over 1/3 of adults will experience a chronic cough, which is defined as a cough that persists for more than 8 weeks with no underlying medical causes within their lifetime. Some will resolve on their own, and others will persist for many years, with the airway sensitivity that triggers the cough being exacerbated by stress and environmental conditions. This persistent cough can impact the quality of life for the patient and cost billions of dollars annually in the healthcare industry for diagnosis and treatment. Current solutions include prescription medication, over-the-counter medicine, and speech therapy. Prescriptive medicines can cause cognitive side effects and then that they can also be addictive, so they're infrequently used and avoided except for the most extreme cases. And studies have shown that over-the-counter medicines are largely ineffective because they just mask the symptoms and they don't actually treat the underlying cause. Speech and behavioral therapy has demonstrated efficacy, but they require numerous office visits over many months or years. Now, retired Faculty member in the Communication Sciences and Disorders program, Dr. Christy Ludlow, and current faculty member, Dr. Aaron Camerunas. They study the interactions between the brain and the control reflexes that are related to speech and swallowing. And while investigating swallowing reflexes in some of their patients, they noted that the application of low-frequency vibrations to the exterior of the neck reduced the sensitivities that cause coughing. Dr. Ludlow filed an intellectual property disclosure with the university, and we are currently actively pursuing a patent for this non-invasive chronic cough therapy concept. Based on scientific studies, both here at JMU and elsewhere, vibration application, think about your phone's vibration setting, applied to this area of the neck overloads the sensory receptors in the larynx, and over several weeks desensitizes the neurons that cause this sensitivity and urge to cough. Such treatment is non-invasive and does not require multiple office visits, provided that a wearable therapy device can be devised. With Madison Trust funding from 2018, 2 engineering students collaborated with Dr. Camerunas and Dr. Ludlow to develop a proof of principle concept, which is seen here. And actually, if anyone wants to look at the physical prototype, I have it here as well, and it's intended to be situated on the neck right here. This proof of principle prototype, as you can see, was meant to demonstrate the efficacy of the vibration application, but it certainly wasn't designed to be a product. The prototype is connected to computers, to data acquisition and power via those wires there, and certainly is not suitable for an at-home wearable therapy. In clinical tests with the prototype, it was demonstrated that the applied vibrations were comfortable, they were soothing, and did not adversely impact the patient. However, obviously, patients were concerned about the size and the appearance of the device, as well as the tethered nature of it. Last year, within the Office of Research and Scholarship, the Technology Innovation Office sought feedback on advancing and licensing this technology and other technologies at JMU. Significant interest was expressed in this therapy, but similar feedback was provided, highlighting that although the concept had been demonstrated, the vision for it as a product and an at-home therapy device was not readily apparent to investors, licensees, or patients. This Madison Trust project proposes the advancement of the design of this technology from its proof of principle state towards a prototype production-ready design that de-risks and clearly demonstrates it in a marketable form. A wearable device that is small and comfortable and attractive and battery-powered. A device that can be controlled and monitored wirelessly with a simple user interface, and that allows for data sharing and therapy progress to be monitored while affording privacy. To achieve this, product design and engineering expertise from across the university will be leveraged to develop a detailed design that is required to realize this cough suppression therapy in a licensable and marketable form. Details such as battery power, miniaturization, and digital signal processors, wireless communication, user interface design, and design for manufacturability need to be considered. The design will be documented, and the effort will culminate in manufacturing and assembly documents appropriate to produce the device. So this funding request is moving forward to compensate the faculty experts and to allow them to work with students and compensate those students for the time invested in advancing this product design. Engineering and industrial design students will be engaged throughout the process, providing a mentored professional experience in product design and manufacturing for those students. And with a fully funded project, we would like to produce approximately 10 prototype units that will allow for future studies to be conducted and demonstrations of the therapy. The availability of these detailed designs and prototypes will clearly demonstrate the product vision and communicate that to potential licensees. and will afford the student researchers and as well as the faculty researchers opportunities to pursue additional grant funding, such as small business innovative research programs and with the National Institutes for Health and private partnerships. Throughout and beyond this one-year detailed design effort, the Office of Research and Scholarship will remain committed to advancing the intellectual property protections and pursuing technology licensing partnerships for the future. So within 2 years, we hope to have the product prototypes completed and be pursuing licensing opportunities. And I want to point out that this is a continuation. We did get to the proof of principle concept based on some initial funding from 2018. With an estimated 27 plus million individuals diagnosed with chronic cough, and by the way, that is an underestimate. We do know that we do think that there is greater prevalence than is actually diagnosed in the population, and approximately 3 million individuals being diagnosed with this per year. This proposed therapy has significant impacts to the quality of life and significant market potential impacts, even with a modest capture of a few million individuals. I should also point out that Dr. Ludlow, who is now actively seeing patients again, has noted an increase in the prevalence due to the recent pandemic and some of the consequences of COVID-19. So your investment will make this impact possible by supporting a powerful collaboration between the inventors, engineers, designers, students, clinicians, and our technology licensing experts. Thank you for your help in advancing JMU's first medical therapy device invention to market realization, and for supporting all of the excellent ideas that are emerging from JMU researchers. I'd be happy to address any questions about the team or the project at this time. Thank you.
Just a question about the device. Is it a constant stimulation, and does the stimulation alter the voice in any way?
There are multiple forms that the stimulation could take. What it is envisioned as is a periodic stimulation, and how the therapy has sort of evolved is basically when there is an urge to cough that is emerging, basically the user would pull out their phone or turn it on somehow to then stimulate that vibration application. And then once it subsides, that application vibration is removed. So it should not alter the voice. There will be a little bit of alteration, but it's a fairly small vibration.
Yes, thank you. Presentation. In the news all the time, they talk about AFib, atrial fibrillation, small electrical devices around the heart. And so what medical advice do you get? What input do you get? Because you're going to put a device, if we get a Fitbit on, we have to check with our cardiologist.
Right.
It's going to affect us. So if someone's wearing a pacemaker or something else, are you getting feedback from somewhere for medical? Unintended consequences?
Oh, unintended consequences. Yeah, and that's where we need to work with. So Christy Ludlow and Dr. Camerunas are experts in that area. We would need to do some more research after the device is designed to understand how those interactions may potentially interact and impact. And you're exactly correct. We have thought about that, and we don't know exactly what the implementation to those may be.
You can tell from the cough I'm one of your subjects. I'm looking forward to it.
I actually have a Zoom room question for us. So Ryan LeKay would like to know, how do you envision partnering with healthcare providers?
That is a great question. My background is in engineering, so I'll be honest, I am not the expert in that, and we hope to bring in the expertise of Dr. Camerunas on that. She works regularly, interacts regularly with Centera and partners at UVA Medical, but that we do need some feedback in that space. Some of the licensing that has been explored previously did involve medical professionals. Yes, sir?
It just makes you think about other applications beyond perfecting this one. I mean, if you look at that area and whether you're trying to improve one's voice quality or dealing with other issues they may have, are there other areas of research and application that come into play here that you might find other interest?
Certainly. Actually, out in the hallway before this, we were talking with another individual who, for tinnitus, so for ringing of the ears, a similar therapy has been proposed that kind of masks and retrains the sensory receptors. Also, I should point out that the swallowing rehabilitation for patients who have either suffered a stroke or other medical condition. That was actually the genesis of this discovery. So they are applying sort of a massage technique to stimulate swallowing for patients who have challenges with tongue motor control.
Yeah, it could be folks that have acid reflux or Barrett's disease. I mean, there are all kinds of things you could think about that might help alleviate some of those challenges in that same location.
I love the generation of ideas of where else this could be applied.
Great presentation, and love the concept here. Can you just say a little bit more about protecting the IP? And then the second question I have for you is around the software element of this. Mm-hmm. Scope can get pretty broad pretty quickly.
Correct.
Are there plans beyond just activation through software? Are there plans for, let's say, customer experience, data, analysis of data? Can you talk a little bit about what the scope is for this software development?
Sure, and thank you for pointing out the scope and size of the request versus the scope of the project. I think in a full product vision, we would rely on licensees to fully realize the extent of the software capabilities. I think this does provide an enormous opportunity for data collection and transmission back to clinicians to help, and the patient as well, to help them understand their condition. But that's probably beyond the scope of what this project, what this ask is for. Really, we have and are planning to engage industrial design experts and some faculty who have expertise in wearable technologies to consider the user interface and really intentionally design how the customer, how the patient would interact with the device. But I think there are still a lot of other avenues that we will not be able to explore on sort of that data management, processing, and interpretation side.
Are there any other devices like this in the market, or anything similar that you all that have maybe failed or didn't work, or anything that you've kind of researched?
So we have done a pretty extensive search, and that's what we brought actually some of the licensing experts in last year to take a look at, and we did not find any such product on the market. There are a number of labs that are studying this phenomenon, but nothing that is envisioning it as a wearable product. They're again, medical, where you go to the clinic and actually get a procedure or a regular treatment. Those have existed, but there is not a lot of evidence out there about treatment options for chronic cough. And I should note that, I apologize, I didn't address the question about the intellectual property. We have filed, and the initial provisional was accepted, and then we moved through a process of filing the full patent. We encountered a difficult examiner who could not separate the fact that this was not an implantable device. So they kept going back to the pacemaker type of technologies and saying, well, this is the same as that. So what we have done is we went through and revised the claims and have refiled. So we are reinitiating the refiling process that clearly delineates the concept as a topical around the neck application, specific for chronic cough.
Anything else from the group? All right, thank you, Dr.
Thank you so much.